5 silent killers. These are the 5 killers that my staff identified. Some of you have experienced some of these things, and hopefully not all of these things, but chronic kidney disease, hyperthyroid disease, diabetes mellitus, cardiac disease, and cancer. We're going to start with the chronic kidney disease, or chronic, sometimes they'll call it chronic renal disease, or CRD, chronic renal disease, or CRF, chronic renal failure. They all mean the same thing. And I sometimes back away from the chronic renal failure because it's kind of a little more scary word, but it doesn't mean anything different than chronic kidney disease. And if you watch for the subtle signs, you're going to see the excessive drinking, excessive urinating. This one, they don't fill the litter box so that the litter is floating in it, not like you see with diabetes, but you'll notice that the spot that used to be about that big in the litter box is about this big in the litter box. And they, of course, you'll see if you're using clumps, you'll see larger clumping. Weight loss, and this can be subtle. Bad breath is kind of further down the way. So that's not one of the first things you see, but when they come in with chronic renal failure where they're really in trouble, there's a smell to it. It's kind of that acetone kind of smell to their breath. They're lethargic and hiding. This is Cleopatra. She's a 9-year-old female spade. And she has chronic renal failure, and she's in pretty bad shape. You can see she's just lost the muscling of her head here because she's starved for protein. Protein is just pouring out of her kidneys instead of being retained. One of the jobs of the kidneys is to not let the protein leak out of your body, or just the right amount to leak out of your body. When I look at urine, I shouldn't see any urine. And with these guys, I'll start seeing some protein in the urine. So they're starved for protein, so they start trying to get protein every place they can, and so they muscle waste in terms of weight. And then they start to feel like they don't want to eat. And of course, that's just pure weight loss then. And they feel like they don't want to eat because the kidneys are what removes the toxins from your system. So if the kidneys aren't working properly, and here's the number, the UN is blood, urea, nitrogen, blood, urea, nitrogen. The nitrogen from a protein is a sugar and a nitrogen, and as you turn over protein, which you do all the time in your system, all the cells break down and it's replaced with new cells. There's protein into the body, they are broken into the sugar and into the nitrogen. And those products should be able to be recombined and reused in your body, but in kidney disease, that nitrogen floats around, but the sugar is not available to reattach it, and so you see these cats who have really high nitrogen in their body. Should be more than 32 on our lab, and this guy, 137. That's an indication of some of the toxins that are building up in your system. That's just one we can measure, but there are all kinds of toxins that are building up in your system because the kidney can't get rid of them now. And one of the things your cat does at first is try to flush them out by drinking a lot of water, and just pouring water out of your kidney so that it can help take some of these things that are making me feel sick out of my system. But eventually it's overwhelmed, and so we start feeling nauseated. And then these toxins will start to actually cause ulcers. And in really bad cases, we'll actually see ulcers in their mouths. And so not only do they not feel, they kind of feel a little bit nauseated, but now they don't feel like eating or drinking anything because their mouth hurts. And now we go downhill because now we can't flush water through because we don't feel like drinking. And so our kidneys don't have that ability to compensate at all. This is the real, these two numbers are the real numbers, and they're very interesting numbers. Until late fall last year, this was the only one we had, creatinine. And creatinine is a measure of how affected your kidney is. Your kidneys have 75% reserve. What that means is that I could go in and take a whole kidney out and half of the other kidney, and that number would still be normal. That's how much reserve your kidney has. Once you reach beyond this 75%, then that number starts going up. So if somebody says to you, well, your creatinine's a little bit high, that's concerning because it means that you've already compromised 75% at least of your kidneys to do what they're supposed to do. Sometimes that's permanent change. Sometimes it's just a temporary change that we can get some of that to resolve. This number, SDMA, is a new enzyme that we've started to be able to look at. And it will show us when the kidneys are 25% compromised. That's a huge difference, and it gives us a lot of time to do something to support that kidney. So if I find a creatinine that's 2, but an SDMA that's 45, should be no more than 14, then I know that I got at least 25% of my kidneys damaged. I've only got 75% left, which is good. My cat can feel really good at 75%, but I want to do everything I can do to preserve that 75% so that I'm not getting to where I'm starting to see this number go up. So if I could jump, I would do that again. That's one of my really exciting things this year is that SDMA. It comes on all our blood work now. It's included as part of all the blood organ screens that we do. So this is what a normal kidney should look like, split in half. That's why what I said, if I took that one out and the whole other kidney, that one would still do all the work I needed to do. It is made up of three layers. If you see this right here, that's actually where all the filtering is being done in the kidney. And there's actually blood vessels that are circulating around in there and bringing all the blood to be filtered through there, and these little tubules filter it, and then the filtrate drains through here and out of your body. And this is what Cleopatra looked like. And you can see that's all that dead necrotic tissue right in there. You can hardly see that nice filtration area at all. And that's what I talk about when I say that 75% of your kidneys are damaged. That's not a happy kidney. One of the things we can do is look at a kidney with ultrasound. In this ultrasound, you can almost see that little filtration area. You can say, yeah, that doesn't look too bad, and then all the little draining tracts, and then it'll come collect down here and go into the bladder. So we can get a lot of information with an ultrasound on kidneys. What do we do for it? And some of you guys have been through this, but with Cleopatra at 9.2, I'm going to put her in here, and I'm going to put her on IVs, and I'm going to flush her put as much fluid as I can through her without overloading the heart, so that I can get as much of that BUN, which represents all the toxins that are in her system, flushed out. I may have to treat some ulcers in her mouth or a GI tract. Sometimes they haven't moved to the mouth yet, but the cat is not eating, maybe vomiting, and if I do something to calm those ulcers, then they may start eating for me. And a principle for cats is that they need to eat. They may not be eating what they would normally eat when they're feeling good, but they need to have some calories, because you can add liver disease to this if they don't eat. So now you've got a kidney that's not working and a liver that's gone into shock because it doesn't have any calories to work on. I start blood pressure medication to improve the blood flow to the kidneys, because if I get more blood to the kidneys, it's going to be able to flush more of that toxins out of the system. So I may start some blood pressure medication. I have to watch blood pressures. I don't create any low blood pressure conditions in these cats, but that's something that we'll use. Epichitin is an interesting thing. It is a food supplement that pulls some of the toxins through the bowel, into the bowel, and takes some of the toxins out through the bowel movement. So now we're saying kidney will give you some hand in getting rid of this stuff, and we'll have the GI tract do some of the work. Anti-radical vitamins. When your tissues look like this, you have a lot of dying tissues. And if you go way back to your chemistry classes, if you have a hydrogen and two oxygens and they attach because they're positive and negative charges on them, and the positive attracts the negatives, and they attach to each other. A radical is one that's not attached, a negative charge that's not attached. And so you're breaking down a lot of tissue, a lot of protein tissue, you're breaking down a lot of tissue because the body needs energy, needs something to work on, and so you've got a lot of these radicals floating around in their system, and radicals are looking for something to attach to. They have a propensity to attach to tissues that they are near to, so if the kidney tissue is breaking down, it has a tendency to attach to other healthy kidney tissues, and enough of them attach to a healthy kidney cell, it may kill that kidney cell. So not only are we killing the cat cells because there's toxins in their system, not only are we killing the cells because whatever the primary disease is killing the cells, but now we're also killing the cells, breaking down cells, and having radicals that attach to other cells. And so if I can trap those radicals on an anti-radical vitamin, A, E, C, selenium, there's several out there. Astaxanthin is one of the ones that is now being looked at a little bit. Maybe we can slow down the attack on the kidney cells, and that's really important. And that's why it's really interesting to get them with that SDMA at 25%, because maybe I can maybe the only thing I'll have to do is deal with whatever the genetic piece of degeneration in those kidneys are, and I won't have to deal with the fact that we're building toxins because we're not yet there. SDMA isn't real high, or the creatinine isn't real high yet. I won't have to deal with the radicals attaching and killing other cells because I'm going to trap them with something else. And I'm going to slow down that process a whole lot. This is a little bit controversial right here. And that is the high protein, feed them a high quality protein diet. There is like a huge body of knowledge that says in a dog that one of the things you want to do is feed them less protein, because if you feed them less protein, there's just what they need to live. There's less protein that needs to get broken down, and so you don't have all those nitrogens floating around that will feed back and cause damage to your kidneys. And that is what you will do with a dog. That's wonderful, but cats aren't little dogs. And cats don't know what to do with carbohydrates. They make their energies from proteins. They use the protein. When they get carbohydrate, they say, what is this? And they put it into fat. They use some carbohydrates, some of them are exaggerating. They don't use the same level that a dog does or that we do. And so they have a lot of problems with the carbohydrates. And so if you reduce their protein below what they really need to live, because you're replacing it with carbohydrates, then you're actually starving them. So we wouldn't certainly want to go home and feed them pure chicken diets if their kidneys were in failure. But you don't want to drop the proteins to the level that you would with a dog. And I say that's controversial because about half of the really good kidney specialists will say, yeah, Dr. Fagan, you got it. And the other half will say, no, you dropped the protein. My experience is they do better if they keep the protein on, and that's what my group of specialists are seeing as well. I think we'll see that change into a more standard recommendation as we go along, but that's an interesting one that's still to be developed. Some of you guys have done the sub-Q fluids. Once you get home, you've got things kind of quieted down. In order to be sure that you continue that flushing on the kidneys, you give them under the skin fluids. Maybe once a day, maybe 3 times a week. I had one gentleman come in here every Friday and got his cat fluids. And his cat started at a creatinine of 3.6. We didn't have SDMA at that point, 3.6. And we did fluids for 4 years on him. And he lived a very healthy life, and he didn't die of kidney failure, so he was good. And we monitor those kidney levels to see, and now with the SDMA, we can really get very fine measurements of how we're doing with those kidneys